I'm Dr. Dinesh Edirisinghe.
Mhm.
Now my age is like 42 years old, and I had more experience with the tourism part, and I'm a specialist about the pulse diagnosis. Then this is my main character.
Okay, doctor, what is the attractiveness of Sri Lankan Ayurveda?
Actually, there's mainly the Sri Lankan Ayurveda, very strong Ayurveda system. Why I say like this, it's including Sri Lankan traditional medicines,
Yes.
Buddhism philosophies, and also the Indian Ayurveda. It is mix in the Sri Lankan Ayurveda, and very strong, especially the council in part is very strong in the Sri Lankan Ayurveda. And with our traditional indigenous medicine, our orthopedic part is very strong, and the mental disorders cure treatment part, and the poison and something like that. Some part is very strong with the indigenous medicine. That's and so finally I want to say the Sri Lankan Ayurveda is not like Indian Ayurveda. It's different and is very unique Ayurveda system in world.
And I have another question. Some people are calling you as a Dr. CT scan, right? And how come they are calling like that? Can you tell the story?
Actually, it is the first I want to say the pulse diagnosis. So one of the diagnosis method in the Ayurveda, but it's something is very difficult to find this situation, because we need to sacrifice something like that. We need to do some example, the daily yoga, meditations, and something we need to sacrifice, find the person. And with we use for the 3 fingers for the that, and we check with the blood circulation system, and with our healing power, and with our meditations, I can find the patient's body disorders, some deformities and something like that. And after that I arrange some diagrams. And finally I ask the questions, and why I ask the question, I need to realize the diseases correct or no, or something like that. It is the diagnosis system and the method I use, that the people say CT scan, because I can realize the head to feet body, and also I can realize their mind situation.
Okay, so you can know that from all of them from the pulse. You can know from the pulse.
Yeah, actually the pulse, why I use the pulse, is the blood circulation. I use the blood circulation because you know that about the blood is circulating the whole body, head to feet, our blood. And with the pulse touch, I can realize some places. Actually, example, I will say heart. We had some people had heart trouble, cholesterol, or by something like. I can realize that blood supply is some thing is not properly working this heart. And finally, I decide, the heart had some problem, and I deeply check what happened with the heart. And finally, I decide this is the problem with heart, something like that. That I use for the blood circulation. It's easy to realize the body conditions with the blood circulation.
Okay, I understand. Thank you. It's a good interview. Thank you so much.
Okay.